Right now, though, let's turn our attention to day 2 of the junior doctors' strike by the BMA. It's the longest strike in NHS history by doctors. 6 days in what is the busiest week of the year for the NHS. Always in a crisis, certainly always in a winter crisis, but this with a focus on COVID, on rhinovirus, flu. I mean, I don't know everyone else. I know half of people I know are off sick at the moment. People are seriously unwell in the first week of January, and great time to go on strike. Well, not a surprise then. The hospitals in England have made more than 20 requests for striking doctors to return to work because of fears over patient safety. Well, joining me now to discuss this is Dorrell, former Conservative Health Secretary. Good morning to you.
Good morning, Julia.
Thank you very much for joining us. I mean, the timing of this strike and the length of it, obviously a big concern, we know, for NHS leaders. Presumably not a surprise to you, someone who used to be in charge of the health service in this country as the health secretary. The NHS trusts have said to doctors, we need you back here. We can't cope without you.
Well, it's one of the most predictable things in the health service, isn't it? That there's pressures of demand immediately after the Christmas break and in the cold weather, not yet terribly cold, but getting colder in January. So yes, the demand pressures are completely predictable. What's also sadly predictable is that this long-running dispute around junior doctors' pay has been rumbling on in the background since the day Rishi Sunak became Prime Minister. It's over 15 months ago now that this has been an unresolved issue. And for the government to now turn around and blame the doctors when it allowed this situation to develop over a prolonged period, I honestly don't think that people should be persuaded by that. This should have been a priority for Rishi Sunak the day he became Prime Minister, as it should have been with the nurses and the other clinicians in the health service, in order to ensure that we could deal with last year's winter crisis, not to mention this year's, and also the recovery from COVID, which is still miles behind the objectives the government set itself.
And recovery from the lockdown of the healthcare service. I mean, we do need to stress, a lot of these problems were there long before we had lockdowns, but the problems, there are problems from COVID, but there are also problems from if you shut down the healthcare service to pretty much everything but COVID, you end up with that long tail of problems. And we're seeing those excess deaths as well as a result of all of that. The thing is, there are some fundamental issues with the NHS. Look, I think you and I will probably be in agreement there are some fundamental reforms of the NHS system we would need. But we also know there's some simple facts that matter that, for a period of time under the Tories, when we had, cuts in well, not increases in real-term funding, but cuts in the percentage increase in the funding for the NHS, well below what they'd previously been, not keeping in touch, perhaps, with the extra demand of an ageing population and new treatments. We have, compared to pretty much every other Western nation, certainly Western Europe, far, far fewer doctors per head of the population, far, far fewer nurses, far fewer hospital beds than head of the population. We are running our health service, despite spending more than half of our government spending on it, on a shoestring when it comes to healthcare workers. Where is all the money going?
Well, the answer, there are several points in what you just said, Julia. First of all, it is true that we spend a lower share of our national income on health services than most of our comparator countries. That is true. But the two words that didn't pass your lips in that introduction were social care. And what we have done over the last 15 years is to reduce the amount of support we can provide to people who actually shouldn't even need the health service, but find themselves in the health service because social care wasn't able to deal with their needs, and they became iller than they needed to be because we didn't provide the support that we should be providing through the social care system, both to prevent people going into the health service in the first place, and also the other thing that's quite often commented in the newspapers, allowing them to leave hospital when they don't need to be there any longer.
Those so-called bed blockers. Something like 15% of beds in hospitals being occupied by people who should be at home if the care was there for them at home.
Well, walk around any hospital with any manager or any doctor, and they can always tell you of figures are quite often higher than 15%, actually, of beds that are currently occupied by people who no longer need to be there and who would be better cared for if they were no longer in hospital.
And you're better off at home than you are in a hospital. Hospitals are pretty dangerous places for disease, as we know. In terms of how this...
and it's an important point, Julia, for every one case that's like that, a bed blocker, as you describe them, there's actually 4 cases that arrive in hospital that wouldn't have arrived in the hospital in the first place. If the social care system had worked better to support them.
The reason why social care has been massively cut is because of the massive cuts. I think 60% or something ridiculous cut in funding from central government to local government over the last 14 years or so. I think it's very, very obvious that Labour would have made a load of cuts as well if they'd been in power post 2010, and also they would have made, I think, even worse decisions in 2020 on lockdowns and things. So we wouldn't be, probably in much of a different situation if they'd been in power. However, if you cut that funding, councils can't afford to provide the social care. That was a government decision. Well, that ends up costing us far more because these people end up in hospital. That was a dumb decision by the government, wasn't it?
I wholeheartedly agree with that. As you know, I was a Conservative Member of Parliament until 2015. And so I bear my share of responsibility for what happened from 2010 onwards. But what undoubtedly is true, that those austerity policies were pursued far beyond when they needed to be pursued. And the effect of the decisions that were taken affecting local government has been to increase demand on the health service. And we started off this conversation by saying one of the things that's always true in January is a peak of demand for the health service. Well, some of that peak is actually avoidable if government had made different decisions along the way.
Yeah, very interesting. Can I also ask you about big day-to-day in terms of political speeches? Back from their Christmas breaks, Rishi Sunak is going to be making a speech, doing a town hall, and a Q&A in the Midlands. It's 1 year since his 5 pledges. One of them he's achieved in terms of inflation going down, but I don't think he was responsible for inflation going up, and he's not responsible for it going down. The rest of it, not really there at all.
Well, one of the things I guess we can agree about is that inflation is primarily the responsibility of the Bank of England.
Well, it's primarily as a result of what's happened on the international, on the world stage, I think. I mean, I don't think many governments have much to say about it. But Keir Starmer's given a big set-piece speech. We're going to be talking about that in a few more minutes. But he's talked about his New Year message of hope and saying this election could change the character of politics. He's pledged to end what he calls the despair of a downtrodden country. And he says that voters should hold on to their flickering hope that life can get better after 14 years of decline and a miserablest Tory project. Do you think he's right?
Well, I think he overstates his claim, is the simple way of putting it. Look, I've said I was a Conservative until 2015. I'm now a Liberal Democrat because I act for a number of reasons. But one of perhaps the most important reasons at this point is that it's one thing to think that we have a change of government coming and Keir Starmer would be preferable to Rishi Sunak. As it happens, I probably agree with that. But the thing that depresses me is that 2 years on, we'll be back in the same two-party dogfight and we'll be presented only with the only choice available to us would be another version of the Tory party. Could we not have a political system that offered people a more adult range of choices, as other countries do, and have more stable and, frankly, a more competent government?
Hold on, you say that. Is the French government any more stable? Is the German government any more stable? I mean, Germany and Austria and Italy, they can often take. Holland, they can take about 3 or 4 months to actually form a government. And also, Germany, I know. Certainly for about 3 decades, the government didn't even change hands. At an election. It was just when a coalition partner fell out. I'm not sure that's what we want. But it's interesting, you say it's now a Lib Dem. Ed Davey, the Lib Dem leader yesterday, he said he wouldn't rule out an election deal with Labour. He refused to say there'd be a deal with Tories in the event of a hung parliament. And he refused to rule out that coalition. So would you support a coalition with Labour?
I supported a coalition between the Lib Dems and the Conservatives in 2010. And if the arithmetic... Look, people shouldn't be frightened of coalitions. That's what the Tory party is, a coalition between a nationalist I think, protectionist right wing, which is why I no longer want any part of it. The Labour Party is a coalition between a left wing that you and I would agree would be very dangerous for this country. What surely ought to happen is a more flexible system that allows the voter a voice in who forms the coalition government that runs our affairs.
Okay, well, again, you could say we do have our voice. I mean, although those of us like me live in a safe seat, perhaps feel we have less of a voice there. Really good to talk to you, Stephen Dorrell. Thank you very much, former Conservative Health Secretary, now at Lib Dem.